Let's discuss quick tips on how to restoratively rehabilitate a root canal treated tooth. If the anterior tooth has an intact marginal ridge, an intact incisal ridge, and an intact cingulum, as well as the tooth is not aesthetically compromised, this tooth is said to have minimal coronal damage. In such cases, a complete coronal coverage is not required and a conservative treatment comprising of bonded resin composites suffices. In case the tooth has one or two large proximal lesions, as well as if it's an average sized tooth, this is considered to be a moderate coronal damage, and in such cases, a full coverage restoration is usually required. An anterior RC treated tooth is said to have a significant coronal damage in case it has undermined marginal ridge, loss of incisal edge, has a coronal fracture. Such a tooth will definitely go for a post-and-core followed by a full coverage crown. If the anterior tooth has a small circular canal, we usually go for prefabricated post-and-core systems. In case the canal is extremely flared or is oval, we opt for custom-made post-and-core systems in these teeth.